When your child hits a tooth, do you need to go to the dentist? Should you call the dentist? My first answer is when you are choosing a dentist for your child and yourself, a good question to ask is, how do you handle emergencies? It's really important to make sure that there's someone to answer your questions if things happen on the weekends or after hours. Most dental injuries are taken care of best in a dental office and not necessarily an emergency room. If a tooth is bumped, we're not going to want you to come in immediately, but we will want to take an x-ray to make sure that nothing was fractured inside the bone. And then we also want to make sure to have a baseline x-ray to watch what the body does with that tooth as time goes on. With baby teeth, there's 4 different things that typically can happen. One is nothing, which is fantastic. The second thing is that sometimes the body calcifies the area where the nerve is, and the tooth may turn more of a yellowish color. Some kids' teeth get darker, but that doesn't mean there's an infection. And then finally, there's sometimes a pimple that develops right above the tooth in the gum tissue that's telling the dentist and all of us that that tooth needs to come out. With permanent teeth, we also want to get that baseline x-ray. Depending on the age of the child and the age of the tooth, when that tooth comes in will determine the next steps. Sometimes when that tooth is hit really hard, even if it wasn't pushed back, it may need a root canal eventually. But there are other times where it's totally fine and just let the body heal itself. Getting hit in the face is something that happens to honestly almost every child. The best thing you can do is establish a dental home by one so that you can have those questions answered at the right time when those accidents happen.